Are you doing YouTube PT? Are you taking different physical therapy exercises, strengthening mobility exercises, and kind of creating your own plan, and you're trying this thing one day and this thing another day, and you're not exactly sure what's working, or you have all this really good access to this really great information, but you're not exactly sure how to apply it? This is actually one of the great things about the internet, and one of the problems with the internet, right? Is that we have access to all of this information, but it's really challenging to know exactly how it is we're supposed to be able to apply this, right? So physical therapy is not just a group of exercises where you're just going to, I need to strengthen, I need to do some flexibility work. We have plenty of those videos on our YouTube, right? The real benefit of physical therapy is you take an expert, and then what they can do is they can look at you as an individual in terms of how it is that you move, right? So what's your flexibility, stability, and strength like, and seeing how it is you're trying to apply that flexibility, stability, and strength into whatever activity it is that you want to do. Whether you're playing a sport, you're just trying to take care of your kids. The thing is that an expert can help you with being able to apply all of that really great information to yourself. Dr. John did a really great video about low back pain. If you haven't checked it out yet, you really should. We'll make sure to link it, where he talked a lot about low back pain, understanding what it is, and all of the complexities around that. Now, that's expert level information. But the thing though is that a physical therapist then can help you then be able to apply that to yourself, right? So in this world of the internet where everything is so scalable, what we actually need a little bit more of is we need more individualization, right? So we need to take that expert information and apply it to you specifically, okay? That's the work that I do with my patients, is that I say, okay, we have all this really great information. Here's this ideal way of moving. Now, how are you moving, and how do we bridge that gap, okay? So that is some of that benefit of being able to take John's expert level knowledge and then apply it to you individually so you can get expert level care. The same goes then for exercise. So Dr. John explained what's going on in terms of a diagnosis, right? In terms of like understanding what it is that's going on with you and your pain. Then we can also then take a look at, say, something like my hip hinge, my RDL video for the progression of the RDL. And we can say, oh, okay, well, this is great. I'm going to do this 2-leg RDL. I'm going to do this asymmetrical RDL. And then I even go into kind of giving you a little bit of an idea of when you could do one versus the other, right? And that it matters that you should do this progression. But again, a good physical therapist can be the one that's going to help you then of kind of knowing, okay, when is it that I should apply this? Also, is this even helpful for me, right? I have so many conversations with patients who they try doing some of these things and it's like, okay, well, yeah, this is all great to do, but it's actually just not really targeting your specific issue. So then that's where, again, speaking to an expert, speaking to a good physical therapist is going to be the way in which you reduce your pain, you improve your function, you optimize your performance. So remember, you have all this access to expert information, but you also need help in terms of applying that expert information from an expert.